Hello, I'm Darren Magee, and today's topic is looking at generalized anxiety disorder. Now, if you like this video, if you find it helpful, please consider subscribing to my channel for future updates on mental health related topics. But just as a reminder, this video is not a substitute for support from a mental health professional, nor is it a tool to be used to diagnose someone. Now, first of all, anxiety is a normal thing to feel. It's our way of keeping ourselves safe. It's our way of saying to ourselves, something's happening or something's going to happen. I need to be careful. I need to be ready. It's something we feel when we feel a lack of control over something really important to us, or if we feel uncertain or helpless. And if we didn't feel anxiety, think of the mad, silly, crazy, reckless things that we'd be doing. But with anxiety, we're only really meant to feel it in short bursts and appropriate to the situation. For example, we have an exam coming up. It could be a very important exam, so we're going to feel an anxiety around that. It might even be an intense anxiety. But that anxiety is going to ease after we sit the exam, or indeed after we get the results. Generalized anxiety disorder, however, is characterised by excessive and persistent worry about many different things like money, health, family, relationships, jobs, social situations, pretty much anything, even just getting through the day. And this worry is difficult to control and is often out of proportion to the situation or situations that someone with generalised anxiety worries about. They expect the worst case scenario and tend to catastrophize many situations, regardless of any lack of evidence. With generalized anxiety disorder, we don't see a particular issue or long-term issue causing distress, such as, say, a phobia or social situations like social anxiety. There might not be a specific trigger. It could be anything, and it jumps from one thing to the other. Now, some can manage to a level where they can hold down a job, hold down a relationship. For others, it's a nightmare, which has been described like being trapped in their own head. And this can lead to people to avoid situations, avoid choices for fear that they may end up in disaster. Some, when the anxiety is severe, can find it hard to manage even the simplest of tasks. Now, when it comes to a disorder, I often think of it as the impact it has on a person's day-to-day functioning, the impact it has on their relationship with themselves as well as with others. With generalized anxiety disorder, there is a pervasive fear around a wide range of situations and events. Any reassurance or relief is very short-lived, and even if something has been resolved, that anxiety quickly moves to something else. Again, it's been described as like feeling an intense dread, which can sometimes lead to panic and anxiety attacks. Now, according to DSM-5, the diagnostic criteria for generalized anxiety disorder includes excessive anxiety and worry, an apprehensive expectation that occurs more days than not for at least 6 months about a number of events or activities. Now, this could be work, school, relationships, or health, whatever. Secondly, the person finds it hard to control their worry. They find it hard to separate fact from feeling, to regulate their feelings, to problem solve, to even just be in the moment. Thirdly, the anxiety and worry are associated with 3 or more of the following 6 symptoms. These are physical symptoms, and these have to be present more days than not over the past 6 months. So first of all, there's restlessness, being keyed up or being constantly on edge. There's being easily fatigued. There's difficulty concentrating. The mind goes blank. There's irritability. There's muscle tension. There's sleep disturbance and difficulty either falling asleep or staying asleep, or perhaps waking in the morning feeling as if they haven't had any sleep at all. Criteria number 4. The disturbance is not better explained by another mental disorder, for example, a social phobia, obsessive compulsive disorder, health anxiety, or maybe the content of delusional beliefs, such as might be present in delusional disorder or schizophrenia. Fifthly, the anxiety, worry, or physical symptoms cause clinically significant distress or impairment in social, occupational, or other important areas of functioning. Again, can cause a lot of avoidance, safety-seeking behaviours. And the last criteria, the disturbance is not attributable to the physiological effects of a substance or other medical condition. For example, hypothyroidism, or the side effects of medication, or maybe drug or alcohol misuse. So that's the diagnostic criteria for generalized anxiety disorder. Some of the common characteristics and behaviours can include over-analytical thinking, either ruminating over past events, conversations, situations, looking for something they may have done or said for which they may face terrible consequences for later on. There's catastrophic thinking, expecting the worst case scenario, so it's almost like risk assessing kind of thinking. There's mind reading, there's jumping to conclusions based on feelings around something. This kind of thinking can, as I said earlier, lead to panic or anxiety attacks. And these unhelpful thinking habits can quite often lead to what's referred to as emotional reasoning. Again, it's true because I think it, it's true because I feel it, it's true because I've worked it out in my head, it's true because it could happen. And again, this can lead to avoidance, safety-seeking behaviours. The exact causes of generalized anxiety disorder are not fully understood. However, it is believed it could be biological, an imbalance of serotonin, noradrenaline, chemicals in the brain which help regulate and control mood. Or it could be environmental. There could be a history of abuse, bullying, or having experienced long-term stressful, traumatic experience such as, say, domestic violence. There could be a long-term painful health condition or a history of drug or alcohol misuse. It could even be a combination of many of these things. Treatment for generalized anxiety disorder can include medication, talking therapy such as counseling, psychotherapy, a change in diet, a more healthy diet, limiting or cutting out caffeine, taking regular exercise, or again, it could be a combination of these things. However, sometimes with generalized anxiety disorder, people who suffer with that condition, they believe that worrying about situations actually keeps them safe, and the thought of not worrying might be too much of a risk. Now, often when I post a video on subjects like this, there are questions in the comments section, things like, how do I manage this? How do I recover from this? How do I get better from this? I think a good place to start is to maybe either talk to your GP or perhaps talk to a mental health professional like a counsellor or a psychotherapist. So that's a brief outline of generalized anxiety disorder. Now, if you like this video, if you found it helpful, please click like and please consider subscribing to my channel for future updates on mental health related topics. And until next time, thanks for watching.